I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. Fortunate enough to have with us Dr. Christine Schaffner. She is a naturopathic doctor in Seattle, Washington. Welcome, Dr. Schaffner.
Thank you so much for having me.
Delighted, absolutely delighted. I've been so looking forward to this. So I'll share with folks a little bit about your bio, but please, as we segue in, make sure and add things that our listeners would need to know. And it's a good time to thank our listeners for joining us and listening and learning and participating in this functional medicine journey. So you're a naturopathic doctor. You came out of Bastyr, and that's also in Seattle proper.
Yeah, we're Bastyr is in a suburb of Seattle called Kenmore, Washington, right on Lake Washington. Mm-hmm.
So some would argue the preeminent naturopathic medical school in the country, and always topmost in that upper tier. And then you have the Sophia Klinik, and you actually have a number of clinic sites, and you do a lot of work in detox, and also a lot of work around like the lymphatics, toxicity, etc. But please make sure and add things that our folks should know as we start.
Absolutely. Well, you've covered it well, and I love the work that I do. And like you, there's, when we do this work, we see so many people who need this framework and understanding to recover their health. So that's really created a lot of passion for me to create more access. And that's why, we work with a team of doctors, and we have a vision to, have more clinics in the country to support, more patients.
Wonderful. Wonderful. Well, with your blessing, I think one thing that our listeners might be interested in is that we have a common root or roots in sort of where some of our training and what have you came from, because Bastyr is where my mentor in natural and functional medicine was trained and certified 25 plus years ago. Mm-hmm. And then in Montana in 2006, I saw her have this spectacular 2005, this case improved spectacularly. And I said to her, if I get training from the Institute for Functional Medicine, will I be able to speak the language to understand how you help these folks? And she turned it on me and she said, if you take this training, then you'll be able to help the way that I help. And we saw patients together every Wednesday in Montana for probably 7 years. And I remember in the early going, she would say, well, this person is a pretty classic sort of adrenal fatigue picture. And I would say, well, how do you, yeah, I get it, but I don't get it at the same time. Like, what is it that jumps out about the case? And I've noticed during this progression through now doing functional medicine for 14 years that these things kind of come into focus. And given that you're an expert on detoxification pathways in the body, toxicity, and the lymphatics, I'd love us to take a journey on that today. And please include as we go where the impetus or genesis came for you to want a product that you knew what it has in it and how it's made to help with that as a topical. Mm-hmm. And maybe just tell us the story then about some of those. Probably gave you too much on the front end.
Oh no, it's all good. I'll start where my brain goes, and you can can guide me. But I'm so glad that you found your mentor, and that you crossed over into the land of functional medicine and naturopathic medicine. It's we're happy you're with us, right? So but no, I like you're saying, for many of the people who are listening, my specialty is really looking at chronic illness, and I have been practicing medicine for about 10 years. I graduated in 2010, and I right away started seeing patients with my mentor, Dr. Dietrich Klinghardt, and he's a German medical doctor and PhD, and he attracted patients from all over the country that had seen, 20 to 30 doctors. So people who had tried a lot of things and didn't get anywhere. And so, I started my career really seeing really challenging patients, not that they were themselves challenging. It was just, I think, I often reflect on this, that their illness was ahead of our understanding. And so even during my 10 years, I've seen our awareness grow on really what we're treating, why we're treating, and why patients are so sick. What is really encouraging to me, even though, right now, as we're recording this, we're in this kind of very tumultuous time for so many reasons. But what I've seen over the years is that education has grown and people have had stronger voices, and people understand that chronic illness is complex, and there are these, maybe what used to be in 2010, we weren't even talking about Lyme disease. We didn't want to put it on our website. It was very still, something that we just wanted to go under the radar. And now more people understand that that chronic illness is a combination of really what I see is not only pathogens. We're always looking at Lyme and co-infections, viruses and retroviral infections, parasitic infections, fungal and mold infections. So that kind of all of these pathogens that kind of stress our immune system, or, the way that I also look at it, that there can be these stressors that impact the immune system to make us more prone to these opportunistic infections. And those stressors can include environmental toxicants. So we can see, just our increasing exposure, and kind of this Joe Pizzorno, who is a naturopathic doctor who was one of the founding members of Bastyr, he often talks about 1 + 1 doesn't equal 2, right? So we are in this kind of synergistic soup of unknown effects. We do study these things, but it's not just glyphosate, it's not just aluminum, it's not just mercury, it's not just electrosmog, it's not just, root canals. It's this combination of factors that, really tips people over the edge eventually. And so, one other big piece that I don't want to underaddress either is, trauma, and how trauma can affect the body. And we know that, our emotional, our mental, and our spiritual health has a huge impact on our physical health. And so that's something that, I've seen with the team of practitioners I work with. That is a huge part of recovering someone's health when someone's been sick for so long. It's not only the traumas that might make them epigenetically more susceptible to being sick, but it's also the trauma of being sick, right? If you go to 20 to 30 doctors and they don't acknowledge why you're sick, or think that, this is in your head, that's a very traumatic experience as well. So it's this combination, right, of, pathogens, environmental toxicity, trauma. And this is, basically the web of what we're trying to address and unfold, and help people kind of recover their health. And I try to say that, if it was one thing, people wouldn't be so sick. And if this was a linear process, it would be way easier. But this is a very dynamic, fluid process that we really individualize. And we've, with Dr. Klinghardt's, unique wisdom, he developed a system called ART, which is called autonomic response testing. So it's this combination of different techniques plus his own inspiration to create this, biofeedback exam that helps us to really communicate, with the body, and to really prioritize treatment. While it's not 100% perfect, like nothing is, it's a great tool with all of our clinical information that we gain from the patient. And then we use ART to really guide us and prioritize as, treatment. And some of the things, I always like to highlight when I do these talks, that when people come to see us, there are some things that are often overlooked that we call interference fields. And ART helps us to look and identify these things. And interference fields can be things that are interfering from a patient's ability to self-regulate and heal. I always think of, when I explain this to patients, it's kind of like the boulder in the middle of the road, right? We got to get that boulder out of the way so things can flow, the nervous system can communicate, and things can be simple, like scars. So scars can actually hold not only emotional trauma, depending on how they came to be, but they also can have a huge impact on the surrounding fascia and lymph, and basically circulatory flow in the surrounding area. And that can affect not only the local tissue, but distant tissues as well. We can kind of see this fascial network in the body that I'm sure we'll talk more about, that it's a highly interconnected highway in the body. And if you have an area of stress, or, a scar in one area, it can affect a distant body system. I always remember this one case where I injected someone's mole removal on the back of their kind of like shoulder blade area, and their heart palpitations went away like literally the next day. And I don't pretend that I have all the reasons why that happened or how that happened, but I'm just sharing, that is kind of the work that we see when we identify these stresses that can, like scars, and treat the scars. We use neural therapy to treat the scars, but there's all sorts of other ways that can be a really huge stress relief to the body, and so the body can communicate and regulate better. And then the other, big, often overlooked, piece in chronic illness is still the dental work. I mean, I think a lot of people have more awareness around the dental aspects of health, but our teeth and our mouth are intimately related to the rest of our body, and especially, our brain and our nervous system. And each tooth sits on an acupuncture meridian in the Chinese medicine view of the body. And so there can be, if you have either like amalgam filling or a root canal tooth on a certain meridian, that can affect that body system. I see that all the time. And so we really guide people to address silver fillings. People still have those. We also look at root canal teeth. Root canals are essentially dead teeth that can become a focal infection and can be a source of bacteria in the mouth that can go systemic and can really be problematic for people's immune systems. And then we also see wisdom teeth cavitations. When you get your wisdom teeth taken out, sometimes they don't heal properly. And then if you're already either have poor healing or a chronic infection, or for whatever reason that doesn't heal, that can be an area of necrotic tissue and harbor and be a reservoir for infections that can stress the body over time, and especially the lymphatic system. So that's, that's the work we do all the time. And I'm happy to dive into this, but I just want to set the stage for wherever we go, that's the framework that I see. And it's very rewarding work. I always say that, we're always in search of the most elegant path to healing, because it's still, I feel like it takes too long. It's still, I'm impatient, I'm East Coast. I mean, I live on the West Coast now, but, there's part of me that I want to be able to help accelerate patients' healing even more. I mean, we do great work, but it can take a couple years, especially people have been sick for so long. But no, it's very powerful, rewarding work, and our patients seem to be very open, and they might not have started open-minded, but as they get results in these unconventional medical settings, they become way more open, and they have these experiences in their own body that they probably wouldn't have realized if that they would be open to when they started the journey.
Well, that's wonderful. Thank you. I think it sets the stage very nicely. And a couple of things that people may want to learn about that I was intrigued that you just shared. One would be when I heard you mention scars or other areas of the body. I've used the phrase sometimes over the years talking with patients about functional medicine, and I don't know that it's the most elegant turn of phrase, but all of us is talking to all of the rest of us all of the time.
I love that.
I think it's trying to acknowledge that my training in conventional medicine felt mechanistic. The nerves were treated like wires. The heart was treated like a pump. It was a little more like working on a car than my feeling now via functional medicine is the body is a lot more like an ecosystem in nature. And so all that systems biology focus makes a lot of sense. And then was really struck by the book, The Body Keeps the Score, about trauma. And so maybe illuminate for our listeners, if you would, what are the mechanics then of how a scar will function as is that an inflammatory effect that there was, it's a form of memory of trauma, and then there's little signaling molecules that leak out and get attracted into that site. And so it's part of this cumulative toxicity because it's sort of an undue heat.
Yeah, and I think we're, continuing to evolve all of the ways to look at that. And I love how you mentioned The Body Keeps the Score. I usually say that just that book title alone gives people the idea that, that we might not have these conscious memories, but an unconscious are basically our cellular memory still might not have resolved an issue. And so I always, use that as an analogy. And so to get back to your, just what's happening in the scar. So in neurotherapy developed in like the 1920s in Germany. It's an injection technique. They use injections to treat scars. They also treat ganglia. We also do segmental therapy, and I can go down that. But what their understanding and what I've been trained to learn about a scar is that basically the cells in a scar, and when you think about scar tissue, it's very different from the connective tissue in healthy tissue, right? The tissue that hasn't been traumatized. So scar tissue basically is this, denser tissue, and the actual cells in scar tissue tend to have a lower resting membrane potential than a healthy cell. So we know a healthy cell usually is about negative 70 millivolts. Last time I checked, that's what's coming up in my brain. So I could be off a little bit.
Mine too.
Yeah, so I fact check me, but it's around negative 70 millivolts. And so, our bodies, communicate with biochemistry, of course, that's what we all learned in medical school. And then there's this whole other aspect where our, bodies, our body creates and our cells communicate with biophysics. And so when we're talking about cell voltage, it's an electrical charge basically because of and that's even a little bit debatable of why that is right now. But essentially that cell voltage is very important for our cells to communicate and signal to each other. And so a cell in a scar typically has a lower resting membrane potential. And so that sets up basically stress in the autonomic nervous system, because these are basically identified as unhealthy or stressed cells. And so there's this low grade stress signal going on in this tissue, and that's creating a systemic stress because our body is interconnected. When we look at these beautiful pictures of fascia and the extracellular matrix, this the Pischinger and these Germans like Heine, they have these books written about the extracellular matrix, and it's this intersection where our blood supply and our nervous system and our lymphatics all combine to communicate and kind of take note of the environment to communicate to our nervous system and the rest of their body. So when we have this lower cell membrane potential in these cells, it's this low grade stress. And the cool thing about neural therapy is what the neural therapist has found over the years is that by injecting the scar we use procaine. Procaine is a local anesthetic. It's 1% preservative free. We use it compounded, so it's very clean. Neural therapists have used this, for 100 years now.
Mm-hmm.
And procaine has the ability, it does a couple different things, but it helps to break down scar tissue. So it's softening that tissue. So then, the lymphatics and the fascia and everything can communicate more clearly, also brings circulation to the tissues, but it also has an effect on the actual cell to help with the ion exchange in the cell to help raise that cell membrane potential to help kind of reboot or reset. Not that it's going to automatically just go to negative 70 millivolts every time with one injection, but it restores kind of a healthier cellular voltage. So then those cells are less stressed to the autonomic nervous system. And so that's one mechanism that I've learned, and I've seen that be, very, clinically relevant in practice. And then, when you think also about scar tissue too, Rob, it's this dense network, right? So what we also see is that toxicity that it gets into the matrix can get stuck in that tissue. So when we think about toxicity in the matrix, a lot of wonderful people have done work with the cell danger response and kind of looking at, what are these triggers in the matrix. But, glyphosate can hang out and disrupt, the collagen structure in the matrix. Heavy metals, because of their charge, can, hang out and, affect, proteoglycans and, also collagen and affect, the communication in that tissue. So then those, because of the denser quality in a scar tissue, those toxins can get trapped more in that area. So that also leads to just kind of more of a, I don't like using this word, but kind of like dysfunctional tissue, and diseased tissue, which creates stress in the rest of the body. So, to oversimplify a lot of what we do, I think a lot of what we do is not only help the nervous system self-regulate and heal, but also to create more flow in the body. So more movement, more flow. So then all of these systems we've talked about, and these, are basically our body and our tissues can, receive oxygen and nutrients and exchange, get rid of waste and all of that. And so a lot of what we do with, a scar therapy is to create more flow in that tissue for all of those reasons. So I hope I answered your question.
Yeah, that's great. I think it's a great example. And with the neat things that you're sharing, I'm realizing we could riff for days, which is part of a fun new aspect of my job, is again getting to talk to experts and finding that I'm meeting my tribe, right? And so it's really a blast. And then one of the pain points is like, oh my gosh, I want to hear about that for 6 hours because I've got 100 questions about that. I want to remember to ask you, what I see in my practice is if somebody comes in and they're excited about something they've heard I do, but then when they hear what will set the stage for the therapy to work is, in today's example, the Institute for Functional Medicine Detox Whole Food Plan and hydration, and you getting all that circulation flowing via exercise and sauna and having a positive attitude, which affects those peptide intracellular cell-to-cell signaling pathways. Then when disabuse me of this presumption if I have this wrong, but I imagine somebody who's taking care of themselves in that fashion, when you put the procaine in, they have set the stage for success. If all of the avalanche of toxicity and stuckness and that unhappy island of tissue is going on, and they haven't created an environment for success, I suspect a local effect is not as helpful from the injection. Is that accurate, or sort of?
Yeah, I think that is absolutely, accurate. One other aspect is, when we, I can see it in a couple ways. So one is, yes, when you do these foundational pieces, you kind of set, your body's primed and ready for whatever intervention, we're going to do to have a, ideal or optimal response. I see that a lot, I love it when I work with patients who have done so much work and then they come to me, they're ready. Like, we do a couple scar injections, we do some dental work, we do some things, and they're better, or, they come to me for their first appointment and they've done all this work and their body's really ready to release. And, we do a scar injection and they have an emotional, release, which can happen. It's a very somatic experience where I've seen it time and time again where, it's not a conscious, it's a very body, somatic sensation where they're releasing stored emotion in their body, and that creates flow and release and healing in the system. So doing all those things to prepare, people, absolutely. And then on the other side, I also like to, of course, support, patients. Whenever I do neurotherapy, I give people chlorella or zeobind or binders or, things like that to help to be ready to absorb maybe toxicity that's getting released, from that, tissue, as you described. But yeah, I think I never underestimate the foundations of health. I think they're so important to set the stage for all of the work that we do.
I should acknowledge too, so that I'm not misrepresenting it to our listeners, I've also found I might meet somebody who's so tired and so wiped out and so anxious and so depressed that the first intervention is getting some magnesium and B vitamins rolling just to get the mitochondria booted up a little so that they get some 10% improvement and get rid of that fatalistic sense that they're trapped or pinned. So I would be misrepresenting the way I work to say that, each person needs to already be on their lifestyle journey. But just intrigued as you were talking, thinking about the, how people would set the stage for success. Let's make sure and tie in the lymphatics then. What should people know about lymphatic function in terms of lymph nodes and the spleen and the, the little itty bitty lymphatic vessels that are involved?
Yeah, the lymphatic system is the most, I find in my patient population, it's one of the most overlooked systems in the body and one of the most rewarding to treat. So many of my patients have an overwhelmed and congested lymphatic system. And, really, this is a wonderful way to get the body moving, to set the stage, not only for them feeling better, but for them to really tolerate treatment. And so the lymphatic system is, again, this body-wide system. We have lymph glands and organs, and we have also lymph nodes. We have the newly or recently discovered lymphatic system in the brain. But I kind of, just to oversimplify it, the lymphatic system is a waste clearance system. So it's definitely a way that our body removes toxicity from our matrix and from our blood. And then it's also an immune surveillance system. So, this is where our body not only can identify and recognize pathogens to mount an immune response, but this is also where pathogens can overwhelm the lymphatic system too. Right? So, when you see a chronic viral patient or a Lyme patient, they're going to have, typically they can sometimes have congested lymph nodes. We know even, in conventional medicine, Epstein-Barr can, create splenomegaly, or, basically swelling in the spleen because of the overactivity of the virus, in the spleen and what it's doing to the blood and all of that. And so we know that toxicity and infections can overwhelm the lymphatic system. And so a big part of our work is to try to create more flow and drainage in the lymphatic system, while also addressing the toxicity and the infections, kind of why it was congested in the first place. And so I'm happy to, dive into all of this. I find that, the more we learn about the lymphatic system, I think there's still maybe some assumptions, the medical community has that still need to be ironed out, and that where it's this constant, learning and evolution. As I mentioned, the lymphatic system, the lymph system in the brain was only, discovered, I think, in 2015. And then the interstitium, they named this, system, just recently as well. And so why I just say that is I feel like sometimes, here we are 2020, we think we have everything figured out, and, it's an evolving process. And I would love to see more, more research and go into the lymphatic system and really what's going on and how we can help patients, fully recover faster by focusing on the system.
Thank you. Could you give us an example or two of something anyone can do who lives anywhere that's good for their lymphatics? And then
Absolutely.
give us an example too of what they do specifically there with you that sort of requires a team, right?
Sure. Yeah. Absolutely. So, the lymphatic system, there's a lot of home tools that we have people do. So, what we know today is that the lymphatic system doesn't have its own kind of pump. And so it's really relying on the circulatory system and, our body to basically create movement in the lymph system. And so, walking and movement can be very helpful for your lymphatic system. Some patients have these home trampolines called a rebounder, where you're actually jumping up and down to create movement and to create flow in the body. We also do have patients do dry skin brushing, which is an old naturopathic treatment to help move the lymph. And then there's definitely different, herbs and supplements and, drainage that can help, get the lymphatic system moving. One also thing that I think is unique to kind of our understanding, one of Dr. Klinghardt's students developed a type of lymph drainage we call it Sophia matrix, but it basically really focuses on the abdomen first. And so with her work, she found that there is this lymph fluid that can build up in the abdomen that is called radix edema. So it's kind of this lymph fluid between the root of the mesentery and the intestines, so kind of behind the intestines and between the abdominal wall. And this lymph fluid can pool in the abdomen. And you don't have to have a large belly for this to be happening. This can happen just if you've even in thin individuals. And I see it as a result of chronic dysbiosis and inflammation in the gut that, because of all of that stress in the immune system and the lymphatics, in the digestive tract, that, just creates this kind of pooling effect in the gut. And, through her work and her teaching, she tells us to really focus on the abdomen first and get that, fluid draining. And so we have massage practitioners who are trained in, really, it's a deeper movement than normal lymphatic drainage. So it's really kind of getting in there to kind of move that lymph and drain that in the abdomen. And that sets the stage for the head and the neck and the extremities to drain. You can kind of think of it as a hydraulic system, right? So if there's pulling or pressure in one part of the body, that's going to affect flow in the other parts of the body. So so that's something, just to think about when we're looking at the lymphatic system. And again, when our patients come to see us, typically they need support. And so many of my patients in the beginning, if they have the resources or, they have access, I usually have them work with a practitioner who's skilled in either the lymph drainage technique that I shared, or really any lymphatic drainage technique. There's also different, equipment that are from compression pans to the LymphStar, which is electrolymphatic drainage that helps to dissolve and kind of decongest. Some of the people who do lymph drainage all day long, they find that there's like a hardening that happens in congested lymph fluid that needs to be broken up rather, and dissolved. And so there's different devices that can help expedite that process. Some of my patients do really, really well with that. And when you get the lymph system moving, especially in a patient like we see, it doesn't happen often, but sometimes people can feel more flu-like or kind of worse as their system gets moving. And not that I always feel like people need to get worse before they get better, but that typically is a sign that they really need this work. And then we try to just amp up all the other support so they tolerate it better. And one of the things also I want to mention is that when you get the lymph moving, you also want to pair that. We do a lot of colon hydrotherapy or coffee enemas, because you get all that lymph moving in the gut and the abdomen. You also want to help with the excretion of the lymph, some of the lymph that can get excreted through the bowel. And so that can really help people with symptoms, as well as, of course, the colonics and coffee enemas help with bile flow, and bile is essential, to just, it's an essential elimination pathway that's another area we could go down, how congested bile gets in the body. I feel like I talk about lymph and bile all day long, with patients, but those are really, those are kind of keys of, areas where most of my patients have a lot of stagnation. And so we just have to get that moving to set the stage for them to be healthier. And so, so those things are paired. And then we use binders. So I think I mentioned binders already, but binders help to bind toxicity in the gut that actually gets excreted in the bile. And that helps prevent recirculation and kind of get things like mycotoxins and metals and biotoxins and pesticides out of the body. And then if someone's having these, kind of flu-like or kind of these immune reactions as the lymph system's getting moving, we of course want to think like, what are the primary infections that are hanging out in the lymph? Do they have a high viral load? Do they have Bartonella? Do they have a Lyme or Lyme co-infection? And then we use a lot of herbal therapy to help support the body in recovering from one of those infections.
What a blast. It's a whole world.
It's a whole world.
Yeah. Yeah. That's wonderful to hear about it. I was thinking as you spoke, one of the things that I love that you said is that we're always growing in our understanding. And I'm 52 years old now, but when I was in high school, I tried to get my black belt in martial arts. And partway along the way, my teacher left town, and I had to go out of town to get my training and all that stuff. And I remember like the first week of class, so the first year of this 4-year process, the teacher said, there's two kinds of black belts. There's black belts who sort of get more and more, puffed up the farther they go in their training. And then the other kind just get more and more humble the more they know. And he said, any of you that are here, I want you to know in this studio, the kind of black belts we produce are the second kind of black belts, because the more you know, the more humbling it is how complex the world is. And I found this whole world of sort of all the different dimensions of adrenal overdrive and adrenal fatigue. And it's a whole world. I'm dealing with it all day, every day. There's a million variations on a theme. I'll never fully understand it. And it's so different than how it was presented as kind of, Addison's disease, Cushing's disease, and normal adrenal function. Well, there's 10 careers worth of work to do just in sort of adrenal tone or lack thereof, and how it's synced up with all the rest of the body. And so I love getting to hear about this whole world that you're talking about. And I also feel this sense of relief anytime I get to talk with practitioners who I know. When you mentioned that these folks that see you, a lot of them are really worried that they're not going to get well because they've been seen by a lot of people. They've been seen at sophisticated settings. They've been seen by good natural providers. So knowing there's a place, there's these extra dimensions that solve these riddles and get them unstuck, that's got to just make the gratification and the thirst to keep doing the work really, really big.
Absolutely. And I love that. I love everything you said. And, I have the same viewpoint. And like, the more you learn, the more you realize, like, there's so many more questions and there's so much more to be discovered. And I feel like, we're just in the middle of this big paradigm shift, right, in medicine, and I think that there's just, of course, it's patient driven because our patients have been so underserved for way too long. And, we really owe it to them to really come up with a different form of medicine to treat this. And of course, it creates all these other dilemmas of access and, all of these things that we're always contemplating. But yeah, I feel like we really have an opportunity to create this, functional medicine's doing it wonderfully. Naturopathic medicine's doing it amazingly as well. But I think there's still this opportunity, to just really look at what the modern day chronic illness and really study this in a whole new way and create this comprehensive team. I mean, my patients need a team. I mean, it's not, I kind of see my job as the quarterback, right? I just kind of, they come in, I try to connect the dots and put the plan together, but really the hard work starts when they leave my office, right? Between all that I'm asking them to do. And then also, the team of providers that I would be lost without, in a perfect, if we're going to dream up medicine today, Rob, I really, from what I know today, it's like, I would love every chronic illness patient to have a wonderful lymphatic drainage practitioner and a colon hydrotherapist and an IV therapist and someone who can do emotional trauma work with them and, all of these things. And I think it's just, speaks to this multifaceted nature of who we are and just acknowledging that we're not just, our physical bodies with just biochemical reactions. We're just way more than any of that. And I do see, we'll get there, but I feel like we're still in the midst of, just educating ourselves and our patients and society to, keep forging ahead.
When I got ready to, thank you again, when I got ready to start offering functional medicine all over the state of Alaska, the prep was working with Dan Kalish at the Kalish Institute last year, and Dan Kalish down, I think he's based in San Francisco now. He said that he'll talk to experts around the country who kind of are aware of like how mature particular happenings in society are. And Dan Kalish said to this expert, well, functional medicine's in the early adoption phase. And this expert said, well, Dan, it's actually in the pre-early adoption phase. So, and so when he was teaching the class, he said that there's about probably defensibly about 1,000 people that want the work that you and I do versus that want it, just versus the number of people that have the skills. And so I think that's part of my mission with getting the word out, talking with thought leaders and experts, is that then it's a way to sort of propagate in this new digital ether where you and I meet so many people that are hungry for this, and some of the information they're getting isn't the best because some folks are well-intentionally saying this, this means that, and, so they're trying to sort out probiotics and gut health and gut-brain connection and all that stuff. Well, let's make sure and talk dental for a sec. So do people need a biologic dentist if they're concerned about those things, like the communication between, the Institute for Functional Medicine during the certification process has a IFM certified dentist saying, you know, when you open up that root canal, now you've got two compartments that normally don't communicate very much, communicating a lot, and there's a lot of inflammation and a lot of organisms now willy-nilly sort of running around. Maybe talk about whether people need to think about a biologic dentist. And you also alluded to work you all do right there. Is that right?
Mm-hmm. With the team, yeah, we always work with biological dentists. The best scenario with when you have to do either amalgam removal or root canal extractions or cavitation surgery. This is really big work, and it can absolutely propel people forward. But when it's not done with all of the support, you know, people can flare, and it can be, you know, you got to get people back together after that. And so the perfect combination is that biological dentist working with that functional medicine doctor or naturopath in, you know, really close proximity. So in a perfect world where I've seen the best outcomes is when people go to the biological dentist and then they come to our office right after, and then we do the IV work, we do the lymph work, we do, you know, ART to make sure if they need antibiotics, we make sure we provide them, or the herbal and supplement support. It's all also, of course, a lot of prep work along the way to get them to that point. And then, you know, again, you know, the detoxification work as well. And so we use a lot of ozone and vitamin C and, you know, all of these things to support, you know, the immune system, because when you have, you know, these root canal teeth that are, again, dead teeth, and there's that lab DNA connections that every now and then our patient will send the tooth to the, you know, the lab, and it comes back full of bacteria, you know, that are pathogenic, that are, you know, that are known to be disease producing in certain people. So, you know, we've seen different, of course, strep strains, HPV strains, entamoeba. So amoebas can be, you know, in these tooth, you know, fungal or candida, you know, issues. And it's usually a combination, you know, it's not, you know, not just one thing, and it's not, quote, normal flora in the oral microbiome. It's definitely, you know, more pathogenic, you know, bacteria, viruses, or parasitic or fungal infections that are in these teeth. So why I say that is that it needs to be definitely do not do this if you do not have, you know, the right support, because we don't want this to make you worse. We want this to be one of the best things that you do for your health and for your body, and to recover, recover your immune system. And so, yeah, I'm glad you're saying that, and you want to, you know, work with. There's an organization, IAOMT. There's a couple other, you know, organizations that kind of vet biological dentists, but, you know, and some biological dentists will be like awesome at mercury removal and just do that really well. And some, you know, do these root canal extractions or cavitation surgeries all day long. And, you know, so you just want to find the right fit and the right expertise for what you need. And then again, always do that in the context of really good functional naturopathic, you know, care, because it's you know, it's not just a dental issue, it's a whole system, you know, that a whole body system issue. And we just want to make sure you're well supported.
Thank you. Well, I want to make sure we have time to hear from you what it's like to design a product, and also to learn a little bit about, one I was intrigued by it's called Flow, I think. And so did you develop it? If there's already agents out there, how does one decide I need to take the time and energy to make an agent? Is it because you're at a multidisciplinary setting where it feels like, yeah, we've got some stuff that's okay, but it's not exactly what we want? Or does it feel like, no, there's some breakthrough things we know about that we really need to put into a topical? And maybe at the same time, let us know, like, how does a topical agent work systemically? How does it work locally? And how does it work downstream? Like, how's that work?
Yeah, absolutely. So we're, one of the most fun, you know, parts of our work is that we get to, talk as well, like you, just to experts in our, in our field, and, really try to collaborate and try to figure out how to help people better. And, we are good friends with a doctor, Dr. Marco Ruggiero, who he is he's a radiologist by training, but he has done a ton of microbiology work and antiviral work, and he has developed some really unique formulas, and we partnered with him to create this flow cream. And it's a proprietary blend of probiotics, so it's using probiotic bacteria, which produces a peptide, and a specific peptide, macrophage activating factor, which is one of the ways that our bodies communicate to macrophages to clear viruses and bacterial infections. And then because these pathogens are, tricky and intelligent, one of the ways they evade our immune system is by creating an enzyme nagalase that basically disrupts that macrophage activating factor production. And so the cream, has the ability to be a transdermal delivery of macrophage activating factor. And then it also has some other things that, are really supportive, like vitamin D3, oleic acid, chondroitin sulfate. And so it's this wonderful combination to really increase lymph drainage, as well as support the immune system. And to, answer your question in a few different ways, one of the things when Marco was working with us to formulate this, we rented an ultrasound piece of equipment in our office, and we did before and after ultrasounds of our patients and where the cream was applied. And so we were able to demonstrate increased perfusion of tissues. We put it over one patient's spleen, and we saw, increased blood flow to the spleen. We also did the cervical lymph nodes, and saw, increased, drainage and flow in those tissues. And so, we know it works. Of course, like anything, it has to be the right person, the right time, all of these things. But, one of the key areas that we have people put it on is their neck, because part of Marco's work with the late Dr. Bradstreet, he demonstrated, and they found that in children with autism, they had more pooling of lymphatic fluid in their brain. And that was also related to basically the lymphatic system needs to drain via the deep cervical lymph nodes. And so if you have a congestion in the neck and, a chronic viral infection or Lyme or Bartonella or co-infection infection, that can increase basically swelling in those deep cervical lymph nodes that can create pooling and improper drainage in the brain. And just another aside, the lymphatic system is our lymph drainage system in the brain, and it only really works when we're asleep. And it's a really important part of how our brain stays healthy. It's a waste removal system, and we've shown that there's less amyloid beta in the brain when you have healthier sleep, and the lymphatic system works properly. And we also know that people have had traumatic brain injuries, why they tend to be more prone to dementia or neurocognitive neurological illnesses is because of the impairment in the actual anatomy of the lymphatic system. It doesn't work as well. And so they get this buildup of not only debris, but also they also get more, or let me say it this way, their brains aren't clearing not only toxicity, but also not clearing pathogens as well. And so there could be, more viruses in the brain, or Lyme and, co-infections in the brain. And so we need this lymphatic system to be working optimally to have a healthy brain and to really recover anyone from a chronic illness or a chronic neurological disease. And so to answer your question about, a transdermal product. So, I think I always set the stage, people know like hormone patches work and nicotine patches work. And, we know that our skin is a delivery system in the body. And, how I really make sense of it is when about not only the dermis, so basically we have our skin, and then underneath the dermis is what's again a newly found system called the interstitium, which is this kind of fluid-filled network that transports information to the rest of our body. So I believe that the interstitium is really the way that the macrophage activating factor is getting delivered, locally and systemically, and that's why topical products that have something like macrophage activating factor work can actually get into the lymph and get close to those lymph nodes that have the infection. And so yeah, we see a lot of wonderful things with transdermal products, and the flow cream has become a staple in a lot of our patients' protocols.
Wonderful. Boy, again, what a blast. What a whole world.
Yeah.
One thing I thought I should mention for our listeners is that both your and my parts in this have to do with something you flagged in the beginning, which is that chronic toxicity, this cumulative, multifactorial, sort of diffuse team of things that bog our system down, is very different from classic toxicity in a lab full of rats, with a lethal dose 50 of one thing that kills 50 rats. So much of what you and I see and treat all day, every day, is those 100 or 1,000 things out there in the world in 2020 and the way we live, sort of bogging us down. I think the philosopher Fiore Kierkegaard said of his critics, it was like dying by being trampled by 1,000 geese feet. And, chronic toxicity is a little like that, I think. And also, I was struck by something that I read about in a lay book by Candace Pert called The Molecules of Emotion, where she described these 4 and 5 amino acid signaling molecules, peptides, not discovered, but really illuminated as she found the opiate receptor around the same time. She was seeing these cell-to-cell signaling pathways that, just as you're describing today, are playing this pivotal role, but because they sort of hadn't been illuminated, there was the pathways weren't well understood, so they were sort of neglected, and because understanding the pathways was sort of neglected, they were sort of not well understood. So it's a new day.
I love that you mentioned that book. That was definitely I read that book when I was, I think, in high school or who knows when, but it was, definitely a pivotal book in my understanding and just my foreshadowing of loving this work of, she was really the, the mother of psychoneuroimmunology, right? I'm glad you mentioned her.
So inspiring. Well, folks should know, if they listen to this in the video format like this, and then they want to see things you reference like IAO, or the last two initials MT, Mike Tango, IAOMT. The blog transcription will have all of the things that you referenced. It'll have a way people can hyperlink to Candace Pert or your clinic, learn about flow if they're intrigued and they want to try it. And so, and then do you still accept it sounds like you still accept new patients? People come in?
I do. I work, I do, still accept new patients in time. And then I work with a wonderful team of doctors, and, we work together to help people. So if I'm not available quickly, we have other providers who do all the same things I do.
Wonderful. Well, anything that you'd love for people to know based on your expertise that we didn't talk about?
I think we covered a lot, and I really appreciate your time. It's really fun connecting with you, and I hope, people find this helpful, and just, if you're out there, trying to put the pieces together of why you're not feeling well, I hope some of this resonates for you to explore further.
Thank you so much. It's been really great today.
Oh, thank you so much. It was really fun to connect.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.